You can never really have too much of life and good health. And right now, Africans are living longer, healthier lives. The World Health Organization recently announced that healthy life expectancy on the continent has gone up from 46 years at the start of the millennium to 56 years in 2019. That's almost 10 extra years in which a person lives in a good state of health. A key element is improving healthcare. For women, advancements in health services like cancer screening could lead to better and timely treatment. The World Health Organization estimated some 700,000 cancer deaths in Africa in 2020. In Cameroon, one physician has come up with a device that helps to ease cervical cancer screening for women. DW News Africa's Blaise Eyong reports from Yaoundé.
Esmeralda Sarah has regular checkups. Cervical cancer can be treated if detected early, and detection needs screening. For small clinics like this one in the capital, Yaoundé, that used to be a problem. There is no specialist doctor, nor any cancer screening machine. This smart device has changed all that. This is the first time Sarah has tried out the locally made kit.
After the screening, I feel totally fine. That's very different to the previous tests that I've done. The speculum was very different. The one they used before was often very uncomfortable.
Traditional examinations use a metal tool called a speculum to open up the vagina. Many women find that invasive and distressing. Health workers here are finding out about the smart device for the first time. It's made up of a mobile phone and a smart speculum. Nurse Afudo Irene can screen her patients with a smart kit in under 10 minutes. This is a major relief for people like her who work in modest health facilities across the Central African nation.
It is true that we do not have a specialist here, but thanks to this equipment, we can solicit the help of a specialist from a distance who can help with diagnosing a patient and provide better care for the patients.
The new tech was developed by Dr. Taku, a 34-year-old Cameroonian medical doctor and entrepreneur. The device sends data in real time and diagnoses arrive within minutes. The information is later assessed remotely by a specialist.
With this objective is that all women, no matter where they live, no matter where they are found, no matter their socioeconomic levels, can have access to cervical cancer screening at the point of care.
Dr. Taku hopes to launch his smart cancer screening innovation across the continent by next year. At the same time, he continues to develop other tech solutions that can solve Africa's health needs.
I'm now joined by that innovator you saw in the report just now, Dr. Conrad Tanku from Yaoundé in Cameroon. Welcome to DW News Africa. Now, can you tell us more about this smart speculum and how it's different from the traditional approach?
Thank you, Tommy, for having me. So, first, just to give an idea of the context, right? So this innovative smart speculum takes into consideration two very old technologies. One is called the speculum, right? Technology that was developed about 100 years old. And the other is a colposcope. The science behind it is that it's like a microscope which permits you to, the health provider to visualize the cervix on an LCD screen, right? Like a computer screen. Mm-hmm. So, first of all, this colposcope device costs very high, and it's not really available in developing settings. And it plays a really critical role in enabling cervical cancer diagnosis, right? Mm. So what we decided to do is to build around a new innovation by incorporating these two technologies into one portable, easy-to-use device which can easily adapt to the developing world setting, especially in rural areas, and be able to be easily used by low-skilled health providers. We're talking about nurses who are mainly found in rural areas. So basically incorporates a speculum and a colposcope.
And I believe you've got two samples to show us how they compare?
Good. So just to give an idea of what a normal speculum looks like. So this is what it is. I think women should know this device, right? So this device permits a health provider to be able to visualize the cervix, but it has limitations on two cases, right? For the patients, it's sometimes uncomfortable or painful during speculum examinations. And for the healthcare provider, sometimes the health provider cannot properly visualize the cervix after inserting this. So we decided to renovate and come up with another smart speculum device, which is like this, right? First of all, we can compare it to a smaller size. And from the tests we've carried out so far, it proves to be more comfortable for the women and provides a better visibility of the cervix for the healthcare provider. And to bring in the idea of being incorporating the colposcope technology, is that now with this device, we're able to visualize the cervix on a smartphone instead of the high costly LCD screens, which are being used by colposcope. So we have this device, which is portable,
Okay, that's interesting. So you've sort of simplified the whole process. Is this a world first?
Yeah, of course. It's the first time integrating both devices into one and coming out with a portable colposcope, which works as a speculum and as a colposcope in the same device.
Well, then, congratulations on this innovation. You also have breast cancer screening that you carry out as well?
Yeah, I mean, the objective of the project GIC-Med is actually to target the two most common cancers in sub-Saharan Africa. And the philosophy about this is that both core cancers account for more than 50% of all cancers in sub-Saharan African women. So if we can target both of them, then that's a huge impact we'll be creating.
And you're able to sort of use technology to bring these services closer to people wherever they may be. But of course, there are issues to do with electricity. Power outages, are those a problem where you are?
Of course. I mean, we took into consideration the context while developing this technology. So, of course, it's a very difficult context. Talking about electricity supply, as well as internet connectivity as well. But, of course, through a co-creation design model, we try to incorporate all of these to have the most adapted solution to the context. And I think this is what stands out with what we created so far, to be able to adapt to the local context.
All right, Dr. Conrad Tanku from Yaoundé in Cameroon. Many thanks for speaking to us.
Thank you.
To Uganda, where one doctor is winning the hearts of his patients at his private clinic. Timothy Okello lost his sight to an infection, but he has not lost his medical expertise. In fact, he's thriving at his job and helping to fight stigma against the visually impaired. DW's Julius Mugambua reports from Kampala.
This might look like a routine medical examination, but it is not. Dr. Timothy Okello is blind. So to diagnose his young patient, he uses all his other senses. The mother has complete trust in his special way of treating her child.
He works compassionately and he cares for you, and you feel like you're even okay before he can work on you. There's a way he has a touching hand, a healing hand. That's why we can even look for him from where we are from up to where he is now.
In 2011, Okello had been practicing as a doctor for 5 years, but then he was diagnosed with a rare eye infection called uveitis.
They did some surgery there and gave me some treatment, came back, improved. 6 months down the road, still it failed. So I just had to accept what had come my way, and I settled for blindness.
Okello says that adapting to blindness has been a challenge, both at a personal and professional level. But his mental resilience has helped him to cope.
I strongly believe that every challenge has a solution. So I sat down and I had to come up with a way that how best can I practice my medicine with the limitation which I've gotten.
Okello works with a full-time AD who does all the visual investigations, such as seeing symptoms and taking notes. The physician says that more than 10 years of blindness have made him a better listener
My hearing, it's so sharpened ever since I lost my sight. And it helps me a lot. Even sometimes I just listen to the breaths of the baby. I listen and I will tell that, no, the way this baby is breathing, there is a problem. If I'm far away from my stethoscope, I request for it and I pick it more clearly.
According to the World Health Organization's regional office, about 15% of the global population of blind people are estimated to be in Africa. Okello says that they face many forms of discrimination. Through public talks, he advocates for their rights.
Sometimes if somebody does not know your background, it is hard to believe that you can do something. It is hard for an employer to believe that you can deliver.
Okello inspires the blind community. This football team has asked him to lobby support for the blind, using his influence.
The way I've seen all these guys who have come here, most of them don't have mobility appliances or devices that they use to move. For example, white canes. So it's going to help us to link to a way of getting those mobility appliances and other support and equipment that we can use in our game and also in the day-to-day running of our activities.
Okello may have lost his sight, but not the capacity to impact the people he touches with a healing hand.